Hi, this is Dr. Daniel Hockenberry over at Ried Physical Therapy. Today I'm going to be talking a little bit about pain during a certain phase of movement, actually in the back. So we're going to be talking a little bit about that today. So one of the frequently asked questions I often get, especially with a newer patient, is I'm getting pain whenever I am laying flat on my back or if I'm standing upright for too long. This is usually in most cases indicative of some form of stenosis. Most of the time when the back is fully extended, so often when we sleep and we're laying on our back, or if we're up and walking for long periods of time, the back's usually a little more extended. Actually, especially with that, we often tend to see that because of the legs extending backwards, it can apply a little bit more stress to that lower back. So stenosis is something that's fairly common, especially in older adults mainly. Stenosis is something that the actual canal, so that our spinal cord travels through a canal down from all the way up here, the top of our head, all the way down to our sacrum. So the bones here that are a little on the lowest part of our lower back. What we actually tend to see here is that canal itself, so surrounding it, is actually starting to narrow. So then your next question may be, how is that treatable? If that starts to narrow, you can't really do anything about that. Well, physical therapy is actually a tremendous thing to be able to use for stenosis. Often what we're doing is progressing patients through exercises that are not only building their core support, but actually going through and applying some principles that we go and actually put the patient more in a flexed position to open up that area. So we actually provide a little more mobility in those segments so that the actual areas that are narrowing onto the spinal canal are actually opened up a little more, and they're actually the nerve is able to travel through there a little bit easier without applying as much force there through the nerve. So what we actually can do here is teach the patients ways that if they are having a flare where they're getting their pains are worse, they're coming down their legs quite a bit, we're actually able to go ahead and teach you some things that are principles you can follow for years and years to come to be able to keep this away and actually prevent yourself from ever needing some surgeries in the future that can be a really big deal to try and get that to reduce the narrowing in that area. So it's actually something that we see quite a bit of, and we're able to help people out really, really well with.